Welcome back to part 2 of the Dentist Answers Questions series. Today I'm going to be finishing up the questions from last time. Can nerve damage affect your teeth? Yes, it goes both ways. If you had a car accident or any sort of trauma that caused nerve damage in your face, that could end up affecting your teeth, either in lack of sensation or having too much sensation. Why do root canals fail? Root canals can fail at any stage during the process of getting the root canal, restoring the root canal, or taking care of your tooth that just had a root canal. During the root canal process, if any of the canals are missed, meaning not found, or the roots are not cleaned properly, that can lead to an infection later on. After the root canal is performed, whenever you're getting the cap or the crown placed on top of the tooth, if that cap is not made in accordance to the shape of the tooth, and there's any gaps, any bulkiness, anything that's going to lead to it getting food trapped in there, that can also lead to a cavity, which can lead to the tooth being in bad shape in the future. Lastly, if you do not take care of the tooth, meaning you don't brush it well, if you don't floss well, let's say you grind at night or you clench at night as well, that can put additional forces on the tooth and make the tooth either break into pieces or get another cavity as well. Why do some babies get their teeth sooner than other babies? One word: genetics. There's not much you can do about that. You know, your baby's teeth are either going to come in at the right time, a little bit earlier, a little bit later. When to call a dentist? Sensitivity, pain. Call them as soon as possible. Sensitivity may be normal, some discomfort may be normal, but give them a call, send them an email just to make sure that everything's going according to their plan. How often are x-rays done? Usually every year. Usually. But it all depends on what procedures you're having done. If you're having implants done, any kind of surgeries, you're probably going to be doing them more often. When it comes to panoramic x-rays, x-rays that go around your head, or full sets of x-rays where they take 16 or 18 little films around your mouth, those are typically done only every 3 to 5 years. How do you get tooth decay? Well, tooth decay, otherwise known as a cavity or caries, is formed by your friend Streptococcus mutans. Strep mutans is the main bacteria that causes cavities. In order for a cavity to form, you need a couple of things. You need the germs, you need an acidic environment, and you need food for the germs to digest. And there you go, that's your magic equation. This is why I say make sure you brush, make sure you floss, lay off the sweets, lay off the candy, and drink more water. When do you need to be numb? Is it always needed? And is it still needed, or is there another option for numbness? Now, I know a lot of people hate getting shots. Most people hate getting numb. They don't like it. Well, here's some good news for you. It is not always necessary. There are procedures that we don't need to numb you for. If I'm working on a tooth that has a small cavity, many times I will attempt to complete the cavity without getting you numb. Now, in the cases where we're preparing the tooth for a crown, if we're doing a root canal, or if we're doing an extraction, those are cases that we want you to be profoundly numb. We want you to be as comfortable as possible. When should you floss? Before or after brushing? This is a great question. If you want to get into a heated argument with your group of friends, bring this question up and see what you get. The reality of things is, it doesn't really matter. I personally have found that most people are not flossing regularly, so that becomes a moot question at that point. Now, if you dig deeper into literature, there is some research supporting flossing before you brush. Now, what does the ADA say about this? They say go either way, as long as you brush and floss every day. Why do some people not get their wisdom teeth? Genetics. Some people get 1 wisdom tooth, 2, 3. Some people get no wisdom teeth. Some people can get more than 4 wisdom teeth. Lucky them, huh? Info about veneers. Well, that's not really a question. Veneers are restorations for the front teeth. When you have your teeth prepared for veneers, a small layer on the outside portion of your tooth or teeth is removed in order to create space for the veneers to go on top of. And then we can either bond filling material in there, and we as dentists can sculpt the teeth into the shape of beautiful teeth. We can also take an impression and send it out to the lab or the milling machine and then cement on, otherwise known as glue on, those veneers into place. The way I think of it is placing a little contact lens on top of your tooth. Veneers are pretty common when it comes to people on TV, famous people and celebrities. You can get veneers if you don't like the way your smile looks, if you have a little bit of misalignment, if you have blotchy teeth, if you want your teeth to look glamorous, beautiful, fantastic. Veneers are great for that. Is flossing good or bad? Fantastic question. Flossing is great. Flossing is life. Floss cleans the food debris or the plaque in between your teeth where your toothbrush bristles are not able to go there. You know, people are brushing their teeth, but they're not flossing regularly, or they're not flossing or brushing the right way either. Now, on a side note, I have to say, I once had a patient tell me that they were not flossing their teeth because they thought flossing would create spaces between your teeth. That is false. Not true. Is enameloplasties necessary? Sometimes it depends if you need them. Enameloplasties is where we slightly polish or remove that top layer of tooth or your enamel in order to create some space. This is usually done during the process of getting braces put on, especially Invisalign. It can be done after you've had fillings made, or also if we're trying to adjust the bite in any way. Since we are removing some of that enamel from your teeth when we're doing enameloplasties, we do need to be conservative when doing so. If you are missing a tooth, what is best? Fantastic question. It depends. Is it a front tooth? Is it a back tooth? Do you have enough space? Do you have enough bone support? What do the x-rays look like? In order to answer this question more appropriately, you just need to talk to your dentist. They need to do a thorough diagnostic analysis of your teeth and then come up with a treatment plan with the pros and the cons and let you decide what you want to do. That is it for the questions. Thank you so much again, North Arlington Pediatrics, for these amazing questions. It was really fun to answer all of these questions. I hope to hear back from you really soon.